perform hand hygiene. Good morning, my name's Kyle. I'll be your nurse today. Can I get your name and date of birth, please? All right, Mr. Jones. Well, today we're going to be doing a physical assessment, and I'm going to have to be listening to your lung and heart sounds, just making sure everything's all right and checks out. Do you have to use the bathroom? All right, he does, and he's going to go to the bathroom. I'm going to assess his gait as he goes to the bathroom. He walks fine. Everything's checking out so far. All right. I've oriented my patient to person, place, and time. And now I'm going to check his pupils, which would be PERRL, which is pupils equal or responsive or reactive to light. I'm going to hold the eye open and come from the outside in. I'm going to do the same. His pupils seem to check out just fine. My patient seems to be well groomed. He's in a good mood. He shows no signs of pain or distress. He seems to follow command pretty well. Now what we're going to do is we're going to assess your skin. We're going to assess his turgor. Since this is a younger patient, I'm going to use the back of his hands to assess his turgor. If he would be an older patient, I would use the chestal area. And I'm also going to check while I'm doing that for temperature and color, and everything seems to be checking out on this patient. I'm going to go ahead and check some pulses. I'm going to check his carotid pulse. You don't want to do it at the same time. It could cause your patient to faint. Then I'm going to check his brachial. And for time's sake, I'm just going to check one side, but you would continue on both sides. I'm going to check his radial. And then we move down to the leg with as little exposure as possible, and we would check the popliteal. And once again on the leg, you would use both sides, but for time's sake. And now I'm going to check the posterior Then I'm going to check the dorsal pedis. All right. Now from here, we're going to assess the patient's heart and lung sounds. I'm going to do as little exposure as possible, yet still being able to perform my procedure. You want to make sure you check all 5 sites. I'm going to use the back of my hand. And while I'm listening to this side, I'm also going to get an apical pulse, which means I need to stay for at least 60 seconds. But for time's sake, we'll cut it a little short. And now I'm going to assess the lung sounds. You might need a little assistance with your patient. And then I'm going to assess the sides, because this is where most of the fluid would be if there was going to be any. I'm going to let my patient relax, completely cover it back up. All right. Now I'm going to perform a little range of motion and check muscles. I'm going to start with the hand. I'm going to apply pressure. You do this to both sides, but for time's sake, we're just going to do one. I would ask the patient to pull towards him while holding pressure, and then I would let him flip his hand. It's hard with this patient. Then I'm going to tell him to push while applying pressure. And I would also get him to try to bend his arm well, which this patient doesn't, while I apply pressure to try and keep him from it. And you would do that on both arms. And then I'm gonna move to the leg with as little exposure as possible. I'm gonna start with the foot. He can move his foot rather well, so I would hold my hand and let him push his foot against my pressure to check his muscles, and then I would hold it and let him pull to check it. And then as I would hold his leg, I would apply pressure and see if he could push his leg out as far as possible. And then I would try and let him bring it in to see if he could do that as well. And we will allow the patient we would apply pressure to the calf area while patient tries to bend heel to buttocks. And my patient seems to check out rather well as expected at least. And we'll also, during this procedure, we will need to check the neck. I will let my patient move his head side to side and up and down. And the patient seems to check out rather well. Now we're going to move to the bowel sounds. I'm also, as any other procedure, going to use as little exposure as possible while still being able to perform my procedure. You're going to check all 4 quadrants. You start with usually the upper left, upper right, whichever side of the bed you're on. And you move side, and then you move down, and then you go back to the other side. You never want to cross patterns. And then I'm going to go ahead and cover my patient up. But when checking for bowel sounds, if you do not immediately hear a bowel sound, you should check for at least 5 minutes. And after that, if you cannot hear one, you should get another nurse to assess it. If that nurse cannot hear it, you have to take immediate action to save your patient. All right, after this, I'm gonna undon my gloves. I'm gonna perform hand hygiene again, and then I'm gonna come and document.